Okay, this is a very important interview because it is some opportunity, some good news about cancer and cancer cells and how a patient's own blood cells can help attack cancer cells. All right, this is good. We've done hundreds of stories on cancer, and it's concerning. And I guess you could say I have cancer because I do, because I had melanoma and 2 shots of it, and they cut it out. And so far, so good. So we have Dr. Lori Leslie, hematologist and oncologist at Hackensack Meridian John Thurer Cancer Center in New Jersey. Welcome. How are you?
I'm doing very well. Thanks for having us.
Okay. And Michael, thank you, Michael. You're treating Michael with this CAR-T hyphen cell therapy. Hi, Michael. Thank you for coming on and sharing your scenario. Well, Michael, actually, tell us, how did you, tell us about yourself.
Sure. Thank you, Paul. Thanks for having us. Well, my experience with CAR T-cell started back in summer of 2018. My wife noticed a lump on my left neck here, and she said, you should have it checked out. Went to a dermatologist, then we went to an ENT, a CAT scan, and a couple biopsies later, it was confirmed that I had lymphoma. At that point, I started looking for an oncologist, and I came to the John Thurer Cancer Center in Hackensack, New Jersey, and got to know Dr. Leslie quite well.
Okay, very good. Similar situation. I was swimming in the pool and my grandkid said, Poppy's got a little black mark on his body. And my daughter heard it. I was at the dermatologist the next week. So a body scan is important, doctor?
Absolutely. Thankful for our families who can notice these things about us, and important to be self-aware of anything that seems different in your body. And I know it's been hard to stay engaged, or harder to stay engaged with your usual healthcare maintenance and primary care visits during the pandemic with some, reduced access to healthcare, but it's just so critical to stay involved so these things can be detected earlier rather than later.
So now tell us how this actually works. Patients' own blood cells, I have blood. We all have blood. Is everybody's blood good to possibly use for helping to cure cancer situations, or how do they go about doing that?
Yeah, so immunotherapy, or using patients' immune systems in a variety of ways, is an important part of cancer treatment, really across all cancers, including actually melanoma, as you mentioned, which is where some of the basic concepts of immune therapy started. Speaking a little more specifically about this CAR T-cell therapy, right now it's approved mostly for people with various types of blood cancers, including lymphoma. So we all have abnormal cells growing in our bodies probably at all times, and the job of your immune system is to recognize those cells and eradicate them before they turn into what you and I think of as a clinically apparent cancer. When that immune system fails, that immune surveillance fails, that's when people develop cancer. So what CAR T-cell does is it takes a patient's own T-cells, their own immune cells, and re-engineers them not only to recognize the cancer, but to be increasingly activated so that they are this own living cancer therapy that's basically a cancer-fighting army of immune cells.
Wow, this must have taken some serious research. And when they do research like this, they have, clinical trial. Is this a clinical trial type of a research?
So for lymphoma, CAR T-cell therapy has been approved by the FDA for standard of care use in certain situations since 2017. It is, of course, everything goes through clinical trials. At the John Thurer Cancer Center in Hackensack, for example, we have a very large clinical trial program in lymphomas that have been involved in a lot of the studies that have led to some of these approvals across blood cancers. But this has been under development, honestly, for decades. And really has been available for about 5 years in terms of the treatment of blood cancers as standard of care.
All righty. I'm going to do the shout out for this company, Kite, a Gilead company. I like the word kite. A kite's probably going through the body and flying around and figuring out things. I think this is magnificent. This is the future. And this is why we're going to live till 1,117 million. So because the more we know. Michael, tell us, so what do you have to do? You have to go get some blood taken out of you and blood put back in you? How does this actually work?
Well, that's exactly right. I mean, after going through a chemo process that most people are familiar with, the CAR T process was different because, again, you're taking your own blood out, it's being shipped across the country and re-engineered, and then we have a point of transfusion or infusion. I went to the hospital for that. They kept me in for the transfusion itself was pretty basic. It was a pack of my blood, but it really packed a punch. Pouch of my blood, I should say, and they kept me in the hospital to monitor symptoms. And a few weeks later, a CAT scan showed a dramatic reduction in the cancer.
So that's marvelous. Do you have any idea, or doctor, do you have any idea, how did this occur? You look like could be playing football for the Giants. You look like a healthy guy. Do we know how this happened with you? Do you have any idea how you got cancer, I guess? Any thought?
I have no idea. That's a good question for Dr. Leslie.
Yeah, so lymphoma, it's a cancer of the immune system. So the immune system basically makes a mistake. It's nothing you did. It's nothing you didn't do. It just can happen. It's not typically felt that it runs in families. And the exciting thing about lymphomas is, there's a wide variety of treatments becoming available beyond chemotherapy, a lot of different options really across cancer. It's a very encouraging time, a very hopeful time. And if you wanted some more information about your lymphoma specifically, or the types of treatments, CAR T or otherwise, that are available, there's excellent resources, Leukemia and Lymphoma Society, or LLS.org, as well as the Lymphoma Research Foundation, LRF, which is at lymphoma.org, have a lot of resources, education and otherwise, for patients, caregivers, and providers.
Let me ask you one last question, then I'll let you go, because I know you have a lot of people to speak with. But lymphoma, does that have something to do with the lymph nodes in the body? Is that what gets the concern is for that part of your body?
Yeah, so lymphoma is a blood cancer. It's the most common type of blood cancer in adults in the United States, and it's a cancer of a type of white blood cell called the lymphocyte. But commonly, blood counts might be normal, and these cells, aggregate in the lymph nodes, leading to a mass or something that the patient or their provider can palpate.
Okay, Michael, I'm going to end with you. Doctor, thank you very much. Michael, you're a good man. You're out here talking about it. From your experience, many other people will be healed because you're big time optimistic. And I want to thank you very much for being on it. I thank both of you. Thanks.
Thank you so much for having us.
All righty.
Yeah, and good luck to you too. Bye-bye.
I know your hospital. I'm a New Yorker. All right. See you later.
All right.
Thanks.
Thank you.
Bye-bye.
Bye.